Assalamualaikum and good day, everyone. We will begin our unit 4 today with topic number 1, which is cleaning, disinfections, and sterilization. For specific learning outcomes of this topic are 1. Define cleaning, disinfection, and sterilization. 2. Differentiate between non-critical, semi-critical, and critical medical devices. 3. Describe the 3 levels of disinfection. 4. Recognize the importance of the correct application of reprocessing methods for assuring the safety and integrity of patient care equipment in preventing transmission of bloodborne pathogens. Okay. Um, this statistics actually just showing you about the chemicals or disinfectants used unsafely while protecting against COVID-19. So we always do need to read the instructions of the products that we buy and always do wear protective gear when you are cleaning or when you are using any spray method of detergent or cleaning products. Okay, and just follow the instructions of the manufacturer. Do not mix the chemicals from other products. All right, so let's look at the definition for cleaning. It is the removal of foreign material, for example, soil, organic material, such as blood, secretions and excretions, or even microorganisms from the surface or object. Cleaning physically removes with water removes rather than kills microorganism. Thus, it reduces the organism load on a surface. As for disinfection, it is a process that eliminates many or all pathogenic microorganisms except bacterial spores or inanimate objects. Okay, and the last one, sterilization is a process that destroys or eliminates all forms of microbial life and is carried out in healthcare facilities only by physical or chemical methods. Sometimes it does being used in many other facilities for research as such. Okay, all right, let's move on. Now we're gonna look at the cleaning process in details part. The first one is manual cleaning. The two essential components in manual cleanings are friction and fluidics. As for friction, it's actually rubbing or scrubbing the objects or the surface area with a brush, for example. It is actually an old method or very dependable method. Okay. Second one is fluidics. Fluidic is actually using a fluids under the pressure used to remove soil and debris from internal channels after brushing, and then when design does not allow passage of a brush through a channel. So brush is always being the number one of choice. If we don't have that choice or we don't have that options, we probably need to use fluidics method. Okay. So the second method of cleaning is mechanical or automatic cleaners. For example, we use ultrasonic cleaners, washer and decontaminators, washer disinfectors, and washer sterilizers. So all these are machines that we use to help us in cleaning. So you can find these machines in our clinic or in a central sterilization department in every hospitals. Okay, so it is very vital for us to use these machines because it does help us in many ways. Okay, so these are the two uh, options or types of cleaning that we need to remember. One is manual, the other one is mechanical or automatic cleaners. So the key to cleaning is the use of friction to remove microorganisms and debris. Thorough cleaning is required for any equipment device to be disinfected as organic material may inactivate a disinfectant. As for now, you probably understand, I hope you understand that every equipment or instrument that we use in the clinic need to be cleaned first in a way that we remove any gross contamination or visible contamination, right, with water and soap or detergent. Then we will use disinfection for some surface area or the instrument itself, and all instrument within certain categories, which we will cover soon, need to be sterilized. So some objects may not go all the way to sterilization, depending on the classification that we're going to discuss later. Okay, so always remember cleaning first, and then we go to disinfection. After the disinfection, the end process is sterilization for any medical instrument or dental instrument. Okay. All right. So this is the word clean, then disinfect. Always remember. So when you are in a clinic, when you're about to start the patient or when you finish with your patient, you need to clean and then disinfect. We're talking about the surface in the clinic that we will cover later, and also the instrument. So the instrument, most of our instrument, we just not clean and disinfect, but we sterilized. Okay, so we will see that in details later. All right, so let's look at the cleaning schedule for a dental practice. This table just to show you um, the classification that we use, right? We will do that more later too, but this table just to show you the site. Okay, all right, let's look at the first one for the site, clinical and high risk areas. Um, Carried out by trained members of the clinical team. That's you and our nurses, our dental assistants, and whoever working in the clinic. Okay, so for this site, for the clinical environment and also high-risk areas, between patient you need to clean and disinfect surfaces and equipment used in the dirty zone using single-use disposable or disinfectant wipes. So normally we will take a wipe, a disinfectant wipe that we have in the clinic, and we wipe all the surfaces in the clinic after the patient, between the patients, before we call in the new patients. Okay, and at the end of each clinical sessions, you need to clean and disinfect all equipment surfaces with clean and dirty zone used during the treatment of patients using single-use disposable disinfectant wipes. So a more thorough cleaning and disinfection process for every at the end of every uh, clinical session. Okay. All right. For instrument or decontamination area or room, surfaces and equipment should be cleaned thoroughly before and after each decontamination cycle. This is what we're talking about when we are cleaning our instrument in the room. We need to clean everything before the new one starts. Okay, so that is about clinical and high risk areas. Whereas the domestic cleaning, we need to take note about sweeping the floor, about the door, cleaning the door. Daily, all rooms and corridors within practice should be clean and damp dusted, including floors, cupboard doors, and all exposed surfaces. So means that if you have cupboard in your cubicle or in your clinic, you need to wipe it every day. Okay, and weekly you need to clean the window blinds. You have to wipe your window blinds, accessible ventilation fittings, shelving, radiators, and shelves in the cupboards. So that is the domestic cleaning that you need to do daily and weekly. So for the dental students, you have to do this in your own cubicle. Okay. All right, let's look at the disinfection. So for disinfection, there are 3 levels. Okay, so this level coincide with the classifications of the items or instrument. So let's look at the first one, low level. So low level disinfection is actually meant for non-critical items. Okay, so non-critical items are those the one that is in contact with intact skin. What does it mean, intact skin? The skin does not have any abrasion, no trauma, no bleeding. Okay, not even mucosa. So it's intact skin. So that is called as classified as non-critical items. All right. So we need to do some disinfection for this. We just wipe it. All right, wipe it with the disinfectant, definitely. Number 2 is intermediate level, which is meant for semi-critical items and non-critical items too, which will come in contact with mucous membrane or non-intact skin. Okay, so for this intermediate level of disinfection, our intention is to inactivate Mycobacterium tuberculosis, vegetative bacteria, most viruses, and most fungi. However, it doesn't necessarily kill bacterial spores. Okay, so for intermediate level, we're looking at the instrument that comes into contact with mucous membrane or non-intact skin. Okay, so in dentistry, we do treat intermediate level different way though, but this is the guideline that we will acknowledge. But for those instruments that come contact with mucous membrane or non-intact skin inside the mouth, we will do a high level disinfection, which we will put in the autoclaves. All right, so for high level, which is what called critical items, okay? It penetrates soft tissue or bone, so means that patient goes to the surgery. Any equipment will be using high level disinfection criteria. So for this high level disinfection, we expect it to destroy, the process will destroy all microorganisms with the exception of large numbers of bacterial spores. Still does not kill the bacterial spores. Okay, so that is the high level of disinfection for dentistry, whether it comes contact with mucous membrane or it used for the surgical, we treat them as critical items. So we will do sterilization method. Okay. Okay, so for sterilization, we're gonna look at these 2 different methods of sterilization. One is physical, the other one is chemical. For the physical, the most common one being used is heat, radiation, and filtration. And then for the chemical, the most common one used are gas and liquid. Okay, so for heat of physical sterilization, it has dry and moist. For radiation, whether it's ionizing or non-ionizing, and for the filtration, they use sintered glass or membrane. Okay. As for chemical, for gas, they use ethylene oxide, formaldehyde, nitrogen oxide, and ozone. For liquid, hydrogen peroxide, glutaraldehyde, and hypochlorite. So these are methods of sterilization available, and it depends on what instrument that is suitable. So not everything can be used with a single method. So every equipment or instrument that we want to sterilize has its own sterilization preference. Okay, so always follow the manufacturer guidelines or recommendations. Okay, so for sterilization, at least we take note these are available. Okay, and it's actually depends on the instrument itself. So for dentistry, normally our metal instrument, it will go through a physical sterilization through a heat. Okay, so that's what we use mostly in dentistry. Sometimes for the other sensitive equipment, we use gas sometimes. Okay, so those are the things that we need to take note. All right. Okay. For the again, just looking at the details of the sterilization methods that we look at now. Looking at the heat sterilization, they are using hot air oven or autoclave. So in dentistry, we normally use autoclave. The normal temperature or regular temperature that we are using is 121 degrees Celsius for about 15 minutes. Okay, and if you look at on the right side, the table, it says what you can do with that method, what can be used for that method. It will be glass, metal, rubber items, sutures, heat-liable substances, culture media, and etc. And as for chemical association for ethylene dioxide, normally they use 800 to 1,200 milligram, all the way to 63 degrees Celsius for glassware, plastic material, metal instruments, intraocular lenses. Okay, so there are others, irradiation and filtration, that you can probably read on your own. All right, so that's just the examples of the sterilization methods. All right, so this is the summary video of what we have just talked in this short lecture. And hopefully you understand the differences between these three. So this video will actually show you about this tree in a better way, I hope. All right, let's watch it. Okay, I hope you understand the whole concept of cleaning, disinfection, and sterilization. So we'll move on to different topics later. Thank you.